special conversation with Dr. Malaraj. Reproductive health, motherhood, mental health combined. Your thoughts on that, please, ma'am.
Yes. So first coming to the mental health, they go through a lot of stress because there is so much of competition. So they are able to juggle all of this and able to maintain a stable mind. So that is really phenomenal, and they know how to take in failures and immediately jump back to normal activities. So they are able to bounce back to their routine immediately, even if they lose any kind of an event, and then they are into their mainstream again. So that is one thing which I have really noticed, that amount of mind frame should be there in all these girls. And when it comes to reproductive health, again, it is the biggest challenge when they have any kind of an event coming up during their menstrual cycle, during their periods. So again, so basically what I understand is that they are able to even maintain that bit of it because they know how to handle that. There are many times, even when you see in practice, the girls give up their their normal activities, even going to school or colleges during their periods when they have pain. But then these girls, they are able to adjust. They know, okay, this is only a part of life, and they do not stop any of this. Maybe they may take some rest at that 1 or 2 days, and then they are able to get into their normal thing. But most important thing is they have to take care of their reproductive health as well. Make sure their cycles are pretty normal, and also the flow is quite all right. So they are able to take part in all the events without any interference. So all those things they generally they're able to go through all of that.
Ma'am, final question. You have touched upon the reproductive health in people, I'm assuming so far in girls who are able-bodied. If I can ask you about girls with disability, and I have in mind somebody like a Deepa Malik, I have in mind someone who has serious disability. Any thoughts on that? Obviously with parasport evolving as a significant, subject of excellence in India at the moment, people are now celebrating para-athletes, and we have seen tremendous number of women coming forward. Your thoughts on people with disability taking to sport, and again, the question of motherhood and reproductive health?
So that is really phenomenal that they are able to do so well, with all those challenges, still they are able to, take part in all these events and push themselves hard to come at that level is something really phenomenal. And of course, even I'm sure even they'll also be having lots of health challenges, which they have really coped up very well. So basically, it is all the rock hard determination and the passion, which is what it really drives all these girls. So I think if you have that, you will be able to manage any of these events. Okay. So mainly, apart from what I really understand is that many times there's certain gynecological issues like endometriosis and polycystic ovarian disease. They are the ones which really stand in way. So only thing what I would like to advise is that if there is something, you have to get treated early. Because mainly in a situation like endometriosis, they will have severe pain during their period. So if they are on proper treatment, proper lifestyle modifications and proper diet, so then they will be able to tackle all of these, and manage, to cross all of these problems at a very early age also. And they will be able to carry on with their sports activities. More so in PCOS patients, you see, obesity is the biggest challenge for them. So they have to constantly keep working on their body and make sure, their the body mass index is within normal limits so that it does not, interfere with their activities. And also the hormonal fluctuations, which also causes like, hyperandrogenism. All those things are also a big issue for these girls.
Deeply, deeply grateful for your time. Thank you.
Thank you so much. Yeah, thanks a lot.
To make this comeback, the last comeback must have been the hardest with the child, with all of it. To be able to even do that, how tough was that? And I remember going to your house, having a chat, 26 kilos, shedding 26 kilos and all of that. How difficult was it?
Yeah, it was. I think physically, of course, it was difficult. That's, a no-brainer because of, losing the weight is only one part of what you're trying to do. Then you have to get strong again. And then you have to train to become a professional athlete all over again and teach your body what to do again. And then you have to try to win and beat the best and be the best version of yourself. So it was definitely very hard, but also it was emotionally hard because thankfully I had no postpartum, which was great. And I think one of the reasons for that was because I started exercise really early after I had a son. And I can't say this enough, like, women need to, right after they have a child, a couple of weeks later, whenever their body is ready, they need to go, because the hormones that are released, it just makes you so happy. You feel worthwhile. You don't feel like your existence is only because of the child. You still accept, because everything becomes about the child after. So when the child is born, the mother is born, but everybody forgets the mother and everything's about the child. So those 2 hours were my sanity. They were my space where I used to go. I used to work out. So I think those kind of things were difficult to deal with emotionally as well. You're going through a lot of hormonal changes. You're seeing your body change. I mean, there are a lot of things. And then the demands of a newborn, waking up like 8 times a night, and you're feeding, and I myself was feeding. So it was a lot. It was a lot. And definitely I think it was probably the hardest thing to do.